can do intercourse, but it doesn't get final that outing, what we call. It comes out, ejaculates. That will not be there. That is obesity, high cholesterol level. That can also cause.
Thank you for joining us. Today we are discussing post-testicular causes of infertility.
Yeah, sure.
Till now we have done pre-testicular, we have done testicular cause, and today we'll be discussing post-testicular causes of infertility. So
yes.
time is yours.
That's right. Yeah. Shall I start?
Yes, sir.
Yeah. So, good evening, friends. Thank you, Jamie, for giving me an opportunity to address you people. I'm so happy to be associated with Jamie Healthcare System, which is imparting education to many doctors, and hope this will be useful to you also. And male infertility, as I told in the last 2-3 lectures, it is a grossly ignored, neglected area, because the infertility is usually blamed as the female infertility. Men are hardly tested for anything other than just a semen analysis. And even the treatment aspect for men is very much limited. So, though the contribution of male infertility is more than 40% by itself, up to 50%, the amount of investigations and treatment done for the men is very much limited. So, to know more about male infertility, classify them is very, very important, so that we can treat them effectively to overcome the infertility. As I told you last time, the male infertility, the mainly oligospermia or azoospermia, can be divided into 3 categories: pre-testicular cause, testicular cause, and post-testicular cause. So pre-testicular cause and testicular cause we have already completed. If you want, you can contact the Jamie Healthcare System and get the link for those 2 earlier lectures, those who have tuned in now. And now today I'm going to concentrate mainly on the post-testicular cause of infertility. The post-testicular cause of infertility it contributes to 15% of the infertility in men. There's quite a huge number. And mainly, 15%? If you go back to anatomy, 15% of the infertile men. Infertile. Taking into consideration the men infertility, the 15% is caused by the post-testicular causes. So coming to the factors which affect post-testicular causes, if you go back to the anatomy of the male reproductive system, so after the testis comes the epididymis, then the 2 vas deferens, then 2 seminal vesicles, and prostate, and 2 ejaculatory ducts, common ejaculatory duct, and urethra, and tip of the urethra, that is the tip of the penis. So any obstruction anywhere in this tract, that is right from the epididymis, the vas deferens, the seminal vesicles, the prostate, the common the right and left ejaculatory duct, common ejaculatory duct, vermintonum, and urethra. Any problem anywhere in this tract can cause the obstruction and cause the post-testicular cause of the infertility. So let us start with one by one. The first and foremost is the infections, genital infections. Genital infections including mumps or AIDS or any syphilis, gonorrhea, chlamydia, or any other genetically, sexually transmitted infections can cause infection of the genital tract. That is, it can cause epididymis, that is called as epididymitis, then vas deferens, that is called differentiitis, then seminal vesicle infection, seminal vesicleitis, then prostatic infection, prostatitis, then ejaculatory duct infection, that is called as ejaculatitis, then urethral infection, called as urethritis. So any infection anywhere can cause the narrowing of the duct, resulting in the obstruction of the sperms coming out from the testis out to outside the body. So infections are the main causes of the post-testicular causes. Yeah. So, Jamie, you want to add something?
Post-testicular cause basically means the sperm, there is a blockage in the sperm traveling.
Yeah, exactly. So it is being manufactured inside the testis, but the person is unable to deliver it outside.
So there's a to produce sperm.
The main cause is infection anywhere in the tract, that is genital tract, causing narrowing of the duct, and that is one thing. So that includes prostatitis, epididymitis, differentiitis. These are the obstructive lesions. The second one is unejaculation. A person is unable to ejaculate. He is producing the sperms, no doubt, but due to various reasons, the ejaculative function is not occurring. That is, due to some reasons, he is unable to do the intercourse and ejaculate into the vagina. That is called unejaculation. He fails to ejaculate. The ejaculatory system is not working. So that is called as unejaculation.
This person
The next one is
this person can have
is important. Important. Yes, important.
Okay.
Important. That is, he cannot ejaculate. There is failure of the nervous system. That is the nervous system, that is sympathetic and parasympathetic nerves, which helps in motility of the semen from the epididymis to the outside the body, that is through the urethral opening. That system is not working. That is neurological defect. That is the epididymis is not contracting. The vas deferens is not giving that sort of movement. That is then seminal vesicles and prostate, they are unable to contract and release the semen. So it is neurological defect where the person is unable to do the ejaculate. He can do intercourse, but it doesn't get final that outing, what we call. He comes out, ejaculates. That will not be there. That is called as unejaculate.
Does it cause any kind of health concerns?
Yeah, it's a major problem. No, he is not satisfied also. Wife is also not satisfied. He's doing the intercourse, but he's not coming out with the semen. It's a major problem. No.
Okay.
It is one of the major causes of infertility in men. He is unable to deliver the goods.
So
that is
beyond not being able to ejaculate, does it cause him any kind of bodily harm?
Yeah, mental agony. No?
Okay.
Say more than the physical agony.
Okay.
He is labeled as important. What else you require? If one labels him as important, 50% of his ego is gone. Not 50%, even that whatever male ego, it will cause. It will have to go for conditions because he is unable to do the intercourse. So that is a major problem.
Okay.
Not only physical problem, but also psychological problem. So that is one thing. Then the next one is hypospadiasis. That is the urethral opening. Urethral opening is not at the tip of the penis. It is below before the opening into the glans penis itself. So the urethral opening is not coming out from the tip of the glans penis. So all the semen will pour out on the way itself, in the shaft of the penis itself. He will be unable to deliver the goods into the vagina. The semen will be lost on the way itself. That is called as hypospadiasis.
Let me recap that because there was a glitch in the video.
Yeah.
Hypospadias is a condition where the opening in the penis is not positioned at the tip.
Yeah, it is before the glans penis. Yes,
okay,
you are perfectly correct.
So
that is birth in this one.
So the ejaculation doesn't come out.
Yeah, okay. That is a congenital abnormality.
Okay, got it.
That is, urethra is not fully developed till the tip of the penis. It's opening before the glans penis itself.
Right.
Since he is unable to ejaculate inside the vagina, the person will land up in male infertility. He has got semen, but he is not depositing deep into the vagina.
And the semen is lost on the and the semen and the sperm might be healthy also. It's just not getting deposited.
Maybe. Okay. In unejaculation, in hypospadiasis, semen may be normal, but it is not being delivered to the spot.
Yes.
The next one is retrograde ejaculation, wherein the semen is not ejaculated into the vagina, but it will go back into the bladder, urinary bladder. That is called as retrograde ejaculation. The semen will not come out.
Okay.
It will go back into the urinary bladder.
So what is the difference between retrograde ejaculation and hypospadias?
Hypospadiasis is delivering outside the body, but not into the vagina, on the way itself. That is, it will be at the penoscrotal junction, somewhere in the penis. Not at the tip of the penis, before the tip of the penis. We can easily collect the semen. Semen comes out of the body, but not from the tip of the penis, but before the tip of the penis. That is in the shaft of the penis. And is delivering. I'll give an example. A courier boy will come and instead of delivering into your house, you will just throw it out in the gate and go.
Okay.
In retrograde ejaculation, you will not give to the delivery to you. You will deliver to the opposite house.
Okay.
So retrograde ejaculation is delivering to the urinary bladder. Hypospadiasis is delivering to you only, but not inside your door, but outside your door, maybe near the gate. It is not serving your purpose. Okay. Is it a bad example? Or
it's a very good example, and I'm understanding.
Yeah. So the courier boy is delivering you, but not to the spot required. He just throws it out at the gate and goes. So you have to go and collect it actually and take it inside your house. Same thing can be done in hypospirosis. The lady can collect all the semen, take it in a syringe, insert directly into the vagina and become pregnant.
So this is where a home insemination kit might come in handy.
Yeah. Yes.
Okay,
Right.
got it.
Then the next one is premature ejaculation. So the person ejaculates, but before the vagina itself. He ejaculates before. That is, before insertion itself, he will ejaculate. It is just like vomiting. He just vomits before the goods are being delivered.
The examples
So
keep coming,
delivery boy
doctor.
comes to door, but instead of handing it over to you, he spills everywhere and goes out. You are collect everything and take it inside. So your home delivery system will again help. So he's delivering, no doubt, but not to your hands. Hand is your vagina. He just spills everything, says sorry, madam, and he just runs out before you can even open your mouth and shout at him. He would have dressed up and gone. That is premature ejaculation. And even erectile dysfunction can cause infertility because he is unable to erect, no erection, no intercourse. He has got a lot of semen, but he is unable to do the intercourse because he doesn't have the stuff, he doesn't have the strength of the penis to insert the penis into the vagina. So he's just hanging his penis around you, but he is unable to enter you. So again, same example as courier fellow. He comes and says, madam, I am unable to give you. Yes, I got the stuff in my bag, but I lost the key in the bag. The stuff I have brought, I don't have the key, something like that. So he has got the stuff, but he is unable to give it. That is due to.
And in this case, there is no chance of getting the woman pregnant, right?
No, he can do, but not because of the ejaculation. We have to give him electroejaculation, force him to ejaculate by other means and take it out. So we have to call a person to open the zip of his whatever the bag he has brought, call a key maker, open it and take it out forcibly and send. That is, in other words, give electroejaculation, ejaculate it and send.
Okay.
It is possible, but by other means. And these are some of the causes. And other causes are surgical causes. Due to some surgery, hernia surgery or scrotal surgery, some surgeon would have inadvertently operated on him and caused damage to the ejaculatory duct or the common ejaculatory duct or the urethra. So something might have gone wrong during surgery and they might have damaged the urethra, the ejaculatory system. That is right from vas deferens, ejaculatory duct, urethra. Somewhere damage would have been occurred by the surgery or radiation or chemotherapy. One of these might have caused the damage to the system, that is the ejaculatory system. And vasectomy, one might have undergone vasectomy knowingly or unknowingly, and that will cause total blockage of this. And another thing is genetic disorder. There is one disease called as cystic fibrosis that can cause bilateral congenital absence of the vas deferens, which we call it as CBAVD. CBYD, the congenital bilateral absence of the vas deferens. In such person, they will have congenital abnormality wherein the vas deferens are absent. That can be easily detected by palpating the testes. So the vas deferens that is coming out of the epididymis will be absent. Sometimes it will be absent on one side, but most of the times it will be absent on both the sides. If the vas deferens is absent on one side, still he can be potent. But if the vas deferens is absent on both the sides, there is a congenital genetic lesion, then the person will be totally infertile. That is absolute azoospermia will be there. That is irreversible damage. That is no vas deferens at all, no delivery system. So again, going back to the courier boy, he is in the courier office itself. He is not coming to your house. So you have to go to the courier office and then collect it and come back. He is not having vehicle or he doesn't have any vehicles or something he says, or is on leave.
You used these examples before?
Yeah. Because most of the laymen, they understand these examples much better than telling me high five words, technically speaking. Oh, your epididymis is this one, and from the epididymis, the vas deferens, it is not functioning. There is a stenosis stricture, and this stricture is causing the obstruction. He will not understand anything. He will say, sir, I have given you 600 rupees. I didn't understand anything what you are calling. So better we come down to the level of the layman and make him understand. Then he will immediately understand. And afterwards, if you use little technical term also, then he will understand it better. So these are apart from this, there will be anti-sperm antibodies. Apart from these obstruction and infections, sometimes the semen is there, but the anti-sperm antibodies are manufactured in the body and they will be killing the sperms by the time it is being delivered or on the way into the vagina or inside the genital tract of the woman. That is, these anti-sperm antibodies are circulating in the body. They are released into the genital system. They are released into the ejaculatory system and they go and kill. They are just like terrorists. In our own army, terrorists will be there who will be that they will be dressed like our own army people, but they will kill our own men. That is anti-sperm antibodies. They are deadly people. They kill our own.
So it's your body thinking that the foreign that the semen is working against the body and killing it off.
Yeah. There are antibodies produced in the body, but killing our own sperms. They are produced anywhere in, and they will be released to the system. So they will kill these sperms.
So
that is
before the ejaculation happens, it's already killed.
No, they may be killed on the way or even in the vaginas.
Okay.
They'll be the sperms are released perfectly from epididymis, but they will be killed on the way.
Okay.
That is post-testicular. Yeah. And apart from this, there may be obstruction by the tumors. Tumor in anywhere in the genital tract, tumor in the seminal vesicle, tumor in the prostate, tumor in the bulbourethral glands, and stone inside the seminal vesicles, stone inside the urethra, stone inside the prostate. They may cause obstruction by the presence of these stones or cysts or tumors. So they are physical obstructions. Shall I go back to the delivery boy and say, he has got a lot of obstruction on the way. Roads are blocked, or he is coming out with suddenly the gate is locked, he doesn't have the key. He has lost his key of the vehicle. He has got everything, but he is unable to come. His tires are punctured, like that. So obstructions, tumors, all this can cause this. And the last one is fructose. Fructose is very, very important from the point of energy to the sperms. And this fructose is manufactured in the prostate. And if fructose is absent, then sperms will die on the way. That is, just like our army people starving. We are unable to send the food to the army people. Then the army people, though they are healthy, they will die because food is not being delivered to them. So that is fructose is absent, and that is another thing. And last but not the least, obesity, high cholesterol level. That can also cause sometimes the some factors called as X factor, and that may result in oligostenospermia. Sometimes the